my name is Shane Flores, and I am presenting on osteoarthritis. So, basically, what is osteoarthritis? What is it in general? What is osteoarthritis? Osteoarthritis is a degeneration of the cartilage between the joints. In most cases, it's based on repetitive movement activities such as um, running, which are high impact sports, squatting, or even everyday use. The population most affected are people that are 50 years old and older. This this slide shows the relationship between how osteoarthritis is related to arthritis. There is primary and secondary reasons of obtaining osteoarthritis. The first one is by age, which is either being 50-year-old or just getting older. And the secondary one is repetitive, which is like basically what we mentioned earlier, which is using high impact sports, which is normally caused from athletes doing repetitive movements. So the other type of relationships to arthritis is inflammatory arthritis and septic arthritis. So moving on to slide number 5, I was like, what are some symptoms of arthritis? Some symptoms of arthritis is joint pain, which is arthralgia from the bone to bone friction. You have the stiffening, crooked condition with the ankylosing, meaning joints are stiff and hard to move or bend. We have the tenderness by joint inflammation from the tenderness of the joint. We have the decreased range of motion from swelling or edema. We also have decreased range of motion from swelling, bone spur inflammation, which is making joints stiff and painful to walk. Alrighty. So, what are some common types of osteoarthritis? We actually have the hip ischialgia, which is hip pain. We have the spine lobodemia. We have the knee, which is the meniscal problems, which is the most common type. And then we also have the hand and foot types as well, which is considered a staphylococcus. Alrighty. And so, what are some risk factors of osteoarthritis? So for the primary, it's those over 50 years old. So those that tend to be 50-year-old also tend to have repetitive injuries, and they tend to actually not being able to work on. They're not being able to work on getting younger, so they tend to get older. Also, sex is also a factor as well. So for females, they're at a higher risk than men due to being less physically fit. The hormones and also estrogen actually has less muscle mass than testosterone. And the risk of menopause. So when women tend to have menopause, and it's like what ends up happening is they tend to decrease bone mass, and so when they decrease bone mass, it's like they tend to have weaker ligaments, weaker bone mass, which actually increases their risk of osteoarthritis. Alrighty. Obesity is also another one as well, mostly due to the increase in exercise ability and also a bunch of weight that's placed onto the joints, which makes it a little bit harder and it increases the inflammation. Joint injuries from restrictions. We also have repetitive stress of joints, which is the secondary conditions mentioned earlier from sports or work-related injuries. Genetics, such as autoimmune diseases, and also so for autoimmune diseases, it's when the so for autoimmune diseases, it tends to attack itself. Bone deformities from repetitive strains, diet injuries, and metabolic diseases. Alrighty, and then so some type of treatments that we do have available is physical therapy for strengthening muscles around the joint. You could also do occupational therapy to help with the surroundings and suggestions of activities of daily living, coping with osteoporosis. Surgery, which is actually adding prosthetics. And then we also have the tensor genes, which actually helps to stimulate the nerves and muscle neurons. Ready? So, and then basically here is my resources, and thank you so much for bearing with me. I hopefully you enjoyed the presentation.